Hey guys, what's going on? Welcome to another video on my channel Hairliciously. Make sure to hit that subscribe button if you guys are new to this channel to stay updated on my second hair transplant journey progress, as well as video topics covering current hair loss and the treatments. Also visit my website at hairliciously.com where I have micro needling devices, dermal rollers, my DHT blocking shampoo, and topical serum, as well as low-level laser therapy, all which I've been using to treat my current hair loss. So before I get started, I wanted to give you guys a quick overview of my hair. I actually got a haircut yesterday, and a lot of you guys were saying that the donor zone behind the back of my head was looking pretty thin. So this is actually my first haircut since my second procedure, and I didn't do anything too crazy. I just cut the front portion just a little bit short, but enough to cover the redness, as you guys can still see, and then just the sides a little bit short. So I particularly wanted to show you guys the donor zone, so hopefully you guys can see. So I'm not exactly sure what type of cut she did, but then I actually asked her to make sure that, she wouldn't expose too much of the scars. And I think she did a good job because she said that she couldn't see any scars when she cut it. So yeah, that's pretty much it. This is how it looks. So today's video is actually going to cover the topic of Botox and its benefits in treating hair loss. When a lot of people hear about Botox, we normally associate it mainly to women using it as a quick fix for cosmetic purposes, especially for wrinkles around the eyes and around the mouth. Botox has actually been used in a variety of applications, including the treatment of certain muscular disorders, migraines, excessive sweating, and even bladder and bowel disorders. And equally important for treating hair loss. I'm going to be covering what Botox is, go over some of the scientific studies that was done to show hair growth from Botox, and I'm going to be covering the costs towards the end of this video. So Botox is the brand name for botulinum toxin. It's a neurotoxic protein which blocks certain chemical signals from nerves, mostly signals that cause muscles to contract. And this is why it actually relaxes the facial muscles that can cause wrinkles in the forehead and, around the eyes. One of the first studies on the use of Botox for treating male pattern hair loss was actually conducted in 2010 by Canadian researchers. It involved 40 men suffering from genetic hair loss, and they were anywhere from a Norwood 2 to a Norwood 4 classification, and they received 150 units of the injection on various areas all throughout the scalp. The study was 60 weeks in total with a 12-week baseline period and two 24-week treatment periods. And what's amazing is the mean hair count increased 18% from baseline to 48 weeks over the initial injection, which is pretty significant. Hair loss was also significantly reduced by a mean of 39%, and response rate was 75%, and there was no adverse events that was noted. So the proposed mechanism behind Botox stimulating hair growth is actually the paralysis of the scalp muscles, which enhances blood flow by reducing scalp tension. The study actually further commented that since the conversion to DHT is enhanced in a low oxygen environment, oxygenated blood reduces this conversion and increases conversion to estradiol. This might be the same mechanism by which Minoxidil affects androgenetic alopecia, and the 18% increase in hair count is similar to that achieved with finasteride, which is pretty impressive. And there's also another study, a recent study, 2017 in India, which evaluated the effectiveness of Botox for treatment of androgenetic alopecia in 10 males, same ranging from a Norwood 2 to Norwood 4. A total of 30 sites were injected with 5 units each on the scalp. And out of 10 patients, 8 had good to excellent response on photographic assessment. At the end of 24 weeks, 1 patient showed poor, and 1 showed fair response to the treatment. And as per self-assessment, 7 out of 10 patients showed good to excellent results. 2 patients had fair response and 1 patient showed poor response to treatment. The photos look really good when comparing the before and after results. And the study was concluded that Botox was found to not only be safe, but also an effective therapy for managing androgenetic alopecia. So currently there really is no FDA approval for using Botox on the scalp. And this is just like an off-label treatment, like dutasteride, especially in the US. But the good thing that makes Botox an ideal treatment when compared to Minoxidil or finasteride is that it can actually produce long-term results with just 1 application of treatment. And it would make sense that you would definitely get better results when Botox is used in conjunction with Minoxidil and finasteride, since they target different mechanisms of action. As far as costs, Botox typically runs anywhere from $10 to $15 per unit. So using Botox on the scalp at 150 units would definitely cost a lot of money. and may not really be cost effective. Both studies actually injected all throughout the scalp, including the front, the mid scalp, the sides, and the crown. So it actually will be cheaper if you're only requiring injections on areas you're balding. So 5 units per area. So if you're, let's say, just balding on the frontal temples, I would assume you would probably need like a maximum of 30 units. So the price would be, around roughly $300 USD, which really isn't bad considering that you only need one treatment that can last for months, and the majority of users have had great results. One thing that I will mention is that the injections may hurt just a little bit. I can't really say for Botox because I've never received Botox injections on the scalp, but as you guys know, I did get injections on the scalp during my first and second hair transplant for the anesthesia, and I can easily say that the injections were the most painful part of the procedure. I don't know how deep they're going to inject Botox, but I would assume that there would be some type of discomfort. But overall, I think it's something worth looking into. But there are some possible side effects, just like any other types of medication, including bruising at the injection site, headaches, muscle weakness. But these sides tend to be rare. We also don't really have any long-term studies on the efficacy of Botox on the scalp or the optimal dosage for best hair yield. So please keep that in mind. So if you guys are not a good responder to current mainstream medication such as finasteride or minoxidil, Botox may be worth a try. So that's pretty much it. That's all I have for today. Let me know in the comments if you would try Botox for the treatment of hair loss, and if you have actually received Botox for hair loss, let me know how that has worked out for you. Thanks for watching, guys, and I will talk to you guys in my next video. Take care.